Hello and welcome to the last in a series of 4 videos on managing your chronic obstructive pulmonary disease or COPD. My name is Susan Nilsson and I have been a registered respiratory therapist for over 20 years. I have seen patients in all different stages of COPD and I have seen what a difference it can make in their quality of life when they are educated about their disease and how it can best be managed. In this last video, I would like to discuss the importance of patient education in managing your COPD. I would also like to discuss communicating with your healthcare provider to develop a COPD management plan designed just for you and your needs. According to the American Thoracic Society, disease management is a total body approach to long-term management of patients with chronic diseases such as COPD. How well a patient is able to care for themselves at home is an important part of disease management. Teaching the patient and their family how to care for the patient at home, how to watch for disease exacerbations or flare-ups, and how to best respond if there is a flare-up are all vital to controlling the patient's COPD, preventing medical emergencies, and slowing the progression of their COPD. COPD disease management tries to decrease or prevent the patient from needing emergency care and hospitalizations. This is done by the patient and their healthcare team working together and providing the patient with the best education possible about their disease and how to manage it in a way that works for them. Education plays an important role in managing your COPD. There are a variety of websites available to help you learn more about your COPD, and then you can take any questions you may have to your doctor. Not all websites have reliable information, so you want to make sure that it is a healthcare website with the most current and up-to-date information available, such as those websites I have given at the end of each video. You can also get information from your doctor or other healthcare provider in the form of handouts and demonstrations on how to use different medications and equipment. You can also attend pulmonary rehabilitation and support meetings, such as Better Breathers Clubs, in your area. The Better Breathers Clubs, or other COPD support groups, are a good way to socialize with other COPD patients and their families who are going through some of the same things that you are. There are many different ways to get all of the information you need to be able to manage your disease. The first place to start is talking to your doctor or other healthcare provider about the options that are available in your area. The relationship between a doctor and patient is a personal one, built on communication and trust. Communication between you and your doctor is a two-way street, so you have to make sure to ask questions if there's anything you don't understand or want to know more about. These are a few tips to help in communicating with your doctor. When going to a doctor for the first time, make sure to come with a list of symptoms, what you have done to treat them, a list of your current medications and their dosages, and any questions you want to ask. Have information ready about your medical history and your family's history. Make sure to provide your doctor with complete information about your condition and history. They need to know personal things about you and your lifestyle, so they need honest answers to decide the best treatment for you. Be sure to take notes so you remember what was said during the appointment. A lot of information will be discussed, so you want to make sure you don't get confused or forget anything. Make sure you ask about all treatment options and make the decision together about what option will work best for you. Find out how and when you will follow up with the doctor. Before you leave, go over your notes and ask about anything you didn't get answered or don't understand. Make sure to follow the treatment plan exactly as it was discussed. You want to make sure you're taking all of your medicine and using your equipment exactly the way it was prescribed. You also want to make sure you know who to call and when if the treatment isn't working or your symptoms change or get worse. Knowing who to call can make the difference between going to the doctor and going to the emergency room. The ultimate goal is for you to be able to control your COPD and not let it control you. The best way to do that is by developing a COPD management plan with your doctor, being as educated as possible about your COPD, and communicating with your doctor about any changes in your symptoms. All of these things will help you to enjoy the highest quality of life while living with your COPD. I want to thank you for watching the last video in the series on managing your COPD. I hope you found all of the videos helpful and informative. If you would like more information or have questions, please contact your doctor or other healthcare provider. You can also visit the websites given at the end of each video. These are great sources of information for you and your family. Here are the websites for information found in this video.